Well, esteemed audience, please allow me to share with some additional initiatives that we at the regional office launched recently. And this particular presentation will be telling you about an operational initiative on accelerating the implementation of TB preventive treatment and systematic screening. We call it PASS Accelerator. As a context, here is the pathways of the patients, and I will focus my presentation on the first stage, which is about the management of TB infection itself. That's because up to recently the management of disease itself was well covered within our operations across the region. And to stress the attention on the need of those operations on latent TB infection, here is an estimate of the overall burden of TB infection in the region made by us back in 2020. This was done by based on the well-known publications regarding the revision of the global burden of latent TB infection. And here are the figures. So considering 14% of the prevalence of TB infection in the region, we are facing a pool of the infection of over 120 millions, of which 2.4 are children. Considering the prevalence of the INH resistance among the TB disease and extrapolating this to the infection itself, we are estimating that 37 millions of the infections resistance to isoniazid. And you see here also prevalence of the 20% of NDR-TB, and extrapolating this to the infection itself, we estimate over 25 millions of those infections across the region, of which almost 500,000 are among the children. Since COVID hit us hard back in 2020, we continue annually to miss every fourth patient that are emerging in the region annually. After 2,000 to 5,000 incidence cases emerging in the region and the national counterparts managed to detect 173,000 patients. So there is an urgent need to recuperate the gap by intensifying active TB case finding. The increase of the prevalence over the years of the HIV among TB is a clear result of an evolving HIV epidemic across the region. And the low coverage of TB preventive treatment among them is a matter of concern. You see bottom left here are the two milestone indicators that the UN high-level meeting is following up, and unfortunately for the European region, TPT coverage among people living with HIV and the household contacts are far behind. The figures related to the emerging MDR burden is presented on this slide, with a quite wide variety of the prevalences among the countries across the region. While having a 20% and 50% of the primary drug resistance and acquired one, this is estimated into over 30,000 new MDR cases. Knowing the prevalence of the pre- and XDR TB among them, 10,000 new XDR cases emerged annually. Continuous emergence of the primary MDR transmission could be avoided if active TB case finding, contacts tracing, and drug resistance TPT as an option would be more available as currently. Back in 2024, prior to the launch of the new Action Plan 2030, we made an impact modeling of the TB trajectory with simulating the impact of the service delivery packages on top of each other cumulatively, and managed to see the contribution towards the decline of TB trends across the years for the region. And unfortunately, those so-called essential interventions, well spread and applied across the region, would not allow us to reach the targets by 2030. The two additional interventions which were largely avoided or neglected across the region, that has a boosting impact on shifting the gear up and continuing the declining trend of the epidemic, are active case finding and TB preventive treatment. The effect of those two are to be considered to be as an add-on to the cumulative impact of the interventions of the essential services from 1 to 8. Well, therefore, TB prevention and systematic screening has their own dedicated core place in the Regional Action Plan 2030, as presented here on the slide. In addition to the action plan list of interventions, the plan has two accompanied attachments. One is the M&E framework with the dedicated for the region indicators to assess the performance of the service deliveries across the region, as well as the investment case. The investment case shows that a small increase in funding, the additional interventions presented to you earlier, would allow by 2030 to decrease the cost of TB fight by three times. Following the launch of the new TB Action Plan 2030, we compiled together back in November 23 a group of country experts and launched the initiative that are focused on gearing up towards ending TB in Europe by intensifying preventive treatment and systematic screening. A network has been established called PASNet that composed of the four elements in it: the national focal points, the temporary advisors, the partners that are key one to support these interventions at the country level, and the secretariat. The network that was composed by 21 countries but not limited to them is supported by the Masters Brigade, the workforce of those temporary advisors of WHO selected on, and the Secretariat itself has its own closed workspace and the public domain. The activities that the workforce provides to the member states includes three packages. The one relates to the systematic screening and the specifying which groups to be focused on, intensifying among them the key interventions to detect active TB cases. These back-to-back teamed with the expansion of TB preventive treatment among those risk groups using the safe, efficient, and people-friendly regimens and approach. We are considering to add on the package also the strengthening of the infection control measures. The communication package, in order to make the member states and partners aware of the initiative, are present on this slide. We've launched the 3 manuscripts that describes basically the viewpoints, outline the landscape and inventory of the TB preventive treatment systematic screening, and also published some practices and the barriers across the implementation of these two groups of interventions. We have a landing page as mentioned earlier. We are considering and working on the manuscripts that are in the pipeline. We are carrying the webinars being held by our collaborative centers and the Global TB program, and we have dedicated encrypted channels in order to operationally discuss the implementation of those interventions at the country level. There is a defined modus operandi on launching the operations at the certain of country, and it implies an intersectorial collaboration within the national TB program between TB preventive treatment, systematic screening, and other area of interventions like diagnosis, treatment, and management of the vulnerables and at-risk populations, and beyond the TB program, collaborating with the governance, financing, medicine, workforce, and information, which are within the health system building blocks. The operational framework of the accelerator itself implies 3 stages, which starts with the policy enhancement, using a review of the service delivery practices, analysis of the cascade of care, and the mathematical modeling of the screening algorithms, a capacity building as a second stage of rolling out, with a number of the materials for the service delivery agents at the front lines, which are the pulmonologists, primary healthcare, and public health epidemiologists. And also the third one, the response and impact monitoring, using the checklists and the list of indicators to assess the performance of the cascade of care. Across these 3, we are considering to launch and implement the drug resistance preventive treatment under the operational research conditions presented to you earlier. The communication about the PASS accelerator was made widely available, and there are operations across the whole region, mainly focused in the East Europe and Central Asia. You see here a follow-up of the tracks of the implementation of TB PASS accelerator across the countries. With this, I would like to thank you all, and once again encourage you to join us on the virtual workspace, where you can find much more materials. Please write to us, and we'll remain at your disposal to reply on additional questions and perhaps provide additional support. Over, and thank you very much.